Next presenter is Dr. Prasanth Kumar, ATHOTA. He is presenting on the Pittsburgh Sleep Quality Index in glaucoma patients.
Good afternoon, everyone. I am presenting about Pittsburgh Sleep Quality Index in glaucoma patients. So, sleep plays a very important role in physical well-being, mental well-being of everyone, and the sleep was mainly controlled by circadian rhythm in the humans. So, there is a scientific basis for sleep in glaucoma patients. We all know that glaucoma is mainly caused by ganglion cell death. So, there are a subset of ganglion cells called intrinsically photosensitive retinal ganglion cells. These cells secrete melanopsin, and this melanopsin plays a role in circadian rhythm and modulation of the melatonin secretion. So we did a study to assess the quality of sleep in glaucoma patients. So this is a cross-sectional study involving the glaucoma patients who are visiting to our hospital. So all the glaucoma patients have characteristic optic disc and visual field changes. They are they are coming to the hospital for the first time. So patients with any known ocular and systemic diseases causing sleep disturbance were excluded from the study. The 7 components of the Pittsburgh Sleep Quality Index were compared with the normal group. So this is the sleep quality index questionnaire. So these are the 7 sleep qualities which were assessed by using this questionnaire. They are subject to sleep quality, sleep latency, sleep duration, habitual sleep efficiency, sleep disturbances, use of sleeping medication, daytime dysfunction. So we included 34 glaucoma patients and 34 agent sex matched controls. So this is the demographic data of these individuals. So in our study, these 4 parameters were found to be comparatively statistically significant between the 2 groups: sleep latency, sleep duration, habitual sleep efficiency, and daytime dysfunction. So I will enumerate all these 4 parameters. So sleep latency is mainly the time taken to go to sleep from the time of going to bed. So the grades indicates the severity. Grade 2 is more severe. So if you see the grade 2, the 6.7% of glaucoma patients were affected, where none of the patients were affected in the normal group, and the correlation was statistically significant. So sleep duration, if you see the grade 3, which suggests more severe effect of sleep duration, so that is less than 5 hours of sleep. So in normal group only one individual was included, but in glaucoma there are 11 people. So habitual sleep efficiency, this is calculated by number of hours slept by number of hours spent in the bed into 100. So coming to the table, the grade 3 is a more severely affected sleep efficiency. So 35 in the glaucoma group was affected compared to the 12 people in the normal group. So in the daytime dysfunction, so 5 people in the glaucoma group were affected, whereas none of them in the normal group had any discomfort. So and all these things are statistically significant. So conclusion is these 4 parameters were statistically significantly different between the normal people and the glaucoma affected people. So take home messages: along with the control of intraocular pressure, we need to consider into the quality of sleep and quality of life while designing our treatment plans for the patient, so that will help them to improve their quality of life. Thank you.
So, and what other significance you can think of, like about the duration and the time of the eye drops or medications they should take?
Yeah,
that
the
should also
treatment
be
plans, whether we are doing medical treatment or surgical treatment, has to be decided mainly on the quality of life of the
quality
patient.
of life, the duration of time. The people who are working in the night time,
Yes.
their duration of sleep is affected.
Yes.
Their sleep cycle is affected. So accordingly, the treatment, anti-glaucoma medications should also be customized from patient to patient. It should not be just a rule that it's a twice a day or it's a 12-hourly dosage.
Yes.
Then we have to think at what particular time that patient has to take it,
Yes.
which will be useful. So we must know the graph of the time when the effect of the medication starts and when it is least. So we have to be more customized in
Yes,
our management of glaucoma patients.
Yes, ma'am.
So it's a good consideration. And another thing is that patients, though you have excluded the patients with systemic diseases, but then it has been considered that nocturnal hypertension is also affecting things.
Yes, ma'am. There are many confounding factors in the study. So, whoever the patients known to be having disorders affecting their sleep quality were completely excluded from the study. So only the patients with the pure glaucoma with the characteristic field and optic disc changes were included. Any other
Fine.
systemic disease and ocular disease were excluded.
Right.
I have a question whether the class of drug was affecting the sleep quality.
Sorry, sir, could you please repeat?
I mean to say, have you assessed different class of drugs we are using in glaucoma?
No,
Their
sir.
association with the
No, sir. To include in this study, we excluded the patients who are using brimonidine basically.
okay, you
So,
excluded them.
We excluded brimonidine patients who are using it, and we didn't see any thing like using brimonidine patients and didn't use brimonidine patients. We are continuously doing this study, so on the way we are going to assess it whether any daytime dysfunction between brimonidine users and non-brimonidine users.
Why you have excluded brimonidine?
Brimonidine was known to be causing daytime dysfunction and it was causing daytime sleepiness. So we keeping that will be affect the study. We excluded the
Because
brimonidine.
that's why the brimonidine is not recommended during the daytime to be
Yes.
portrayed. Thank you very much. Please. Please.
Mainly primary glaucomas, madam. Either both. We didn't look into different.
Consider.
Yes, ma'am. Yes, ma'am. We didn't look into that part. We recently collected data. We are interpreting. We will go into that.
This
That
should
has to be
included.
assessed, ma'am.
This should be included and should be categorized according. Like you have to take in a study, you have to take one type of like only primary open angle glaucomas, then the another study for only primary angle closure glaucoma. So that will be better if we, because totally the pathogenesis is totally different in each of them.
Yes, ma'am.
So we have to consider that also in our study.